This video is going to go over a lot of important signs for first responders, seeing as though we are PTs, PTAs, or other healthcare professionals. They're really good signs to know, especially if you end up in some sort of emergency situation where you are around someone who is deaf and you're trying to get things fixed and make sure everyone's all right. So the first sign is EMT. There actually isn't a sign for that, so you're just going to finger spell E-M-T. And then the next is saying you don't understand. They may say it to you to inform you that they don't understand what you're saying because you're talking too fast and they can't read your lips, or you might want to say it to them if they're signing and they're going a little too fast for you. So you just go like this. The next sign is calm down. In any sort of emergency, people are gonna get lots of adrenaline and probably be a little anxious, so to get them to calm down, you just wanna go like this. It's a sign for calm. And then for hurt, you're gonna wanna just go like this. It's the same sign for pain. So, and you just make sure with any of these signs, if you're trying to make it a question, like I've said before, make sure your eyebrows are down and you look like a little confused so they know that it's a question. So, or are you hurt? And then for medicine, maybe you're getting them into an ambulance or whatnot, or say someone's having like a seizure, panic attack, whatever, and they need some sort of medication. The sign for that is this. So, medicine. And then, do you need help? Take that sign for help from you and give it to the person, like you're giving them help. So, do you need help? And then if you want to ask them what is wrong, you're going to want to know what's wrong. So, what's wrong? And then the next sign is, are you safe? So the sign for safe is this. So the person will tell you either no, not safe, or yes, I'm safe. The next sign is ambulance. So for this, you're going to send the letter A, and you're going to take that A and you're going to make a cross on your outer shoulder. So just to show you that sign one more time, it's just this. Ambulance. And then for hospital, it's the same sign, but instead of using an A for ambulance, you're going to use an H for hospital. So the next sign is emergency. So for this, you take the letter E and you just go in twice. So emergency. And then you have breathe. So for breathe, you take both hands here against your chest and go out. Just like your lungs would go out when you're breathing. So breathe. So if someone's doing this and shaking their head no, they're probably trying to inform you that they can't breathe. The next sign is for bleed. So for that, you have a hand like this, and with your other hand, you go down like that. So bleed. And sometimes there's a variation where they'll do it like twice. So they'll go. Normally, I've seen it be done if the person is like bleeding a lot and they're really trying to emphasize that. And then the last sign is accident. So for that, you start here, hands slightly open and go in and shut them. So accident. And those are the emergency signs. So those are just a few emergency signs that are really good for healthcare professionals and honestly anyone to know, because you never know when something bad might happen and who's going to be there when something happens. So if you enjoyed this video, please feel free to like, comment, subscribe, and share this with others so that more people know these signs and are better prepared.